And this topic is relevant in this present dispensation where we are faced with a lot of challenges here and there. And for anyone who is not mentally and physically fit, definitely is going to affect our productivity and our relationship with others, ever at home, whether at home or at our place of work. Okay, so basically we'll talk about mental and emotional health. But before we go to the main topic, briefly, I just want to define what health is all about. Okay, according to WHO, WHO is the organization that that supervises the health of people across the world. They define health as a state of complete physical, mental, and social well-being, and not just the absence of disease. Okay, so health as a physical, for you to be physically, for you to be fit health-wise, you must be physically, mentally, and socially fit. Now, the physical aspect is what we all know about. What is common, okay? If you have headache, you have body pains, you feel cold, you are vomiting, you are having diarrhea. That's physical part of the health, and it's easy for people to make, to go to the hospital and make complaints, and that will be addressed. The social part of our health has to do with our relationship with individual, whether at work or our neighbors. If you are not socially fit, there's discord between you and your neighbor or your family member, definitely is going to affect your health. And the physical and social part of our health definitely goes a long way to affect our mental health. Now, our mental health affects basically our mind, our soul, our spirits. So oftentimes when people have mental health issues, we tend to spiritualize it, or we tend to neglect it because it's not really causing a major physical damage to us. And in the long run, it's actually a major cause of illness in our society. Please, can we go to the next slide? So our outline for today's presentation will follow this, a brief introduction into what mental health is all about, which is some of the things I've discussed. The predisposing factors, what are things that, expose us to mental illness? What are the ways mental illness manifests? What are the presentations? In what ways do people present with mental illness? Because there are some symptoms that are actually mental illness, but we overlook and say it's just forming or patient. The individual is just behaving somehow, but it's actually a mental illness. Then, what are the ways we can actually manage mental health issues when they come? Okay, so the next slide, please. So, mental health or mental illness is any condition that affects our emotion, our thinking, and our behavior. Our emotion in terms of the way we do things, the way we approach certain conditions, okay? Our thinking, our mental faculty, the way we rationale, okay, the way we rationale about certain conditions, and our behavior, our attitude towards certain conditions. Okay, so these are issues that have to do with our mental health. So our mental health involve conditions that cause changes in our emotion, our thinking, and our behavior. And by the time any of this condition, okay, causes these changes, and it leads to distress. What do we mean by distress? Distress means a form of nuisance, a form of a state where we are not comfortable, okay, then it's becoming significant. That condition is becoming significant. There are some issues that may happen to us, but may not necessarily cause distress, may not necessarily cause nuisance to us. But by the time such condition begin to cause distress, either to us, to any significant other person in the family or in our neighbor, then we need to suspect a mental illness. Okay, and this condition affects our normal functioning, either at work or in the family. So if somebody who wakes up at normally 6, 5, 6, 7 a.m., gets prepared and goes to work. But by 8, 9, person is still on bed, not physically fit, and is withdrawn or, distressed. Then we need to begin to look at a mental illness affecting that individual. So the condition actually causes distress and affects the functioning of that individual. Then we'll talk about mental illness coming up. So this gives us a sense of suspicion when we find out that somebody, either at our place of work or at home, okay, is going through a lot, and it begins to affect other members of the family, such that the person cannot perform optimally in every area of the individual's life. Then we begin to suspect that there is a mental health issue going on with that individual, and we need to take necessary steps. Okay. So, next slide, please. So, mental illness, as we all know, causes disruption in resilience. What do we mean by resilience? Resilience means ability to cope with stress. The armory, the coping mechanism the individual has that enables him or her to be able to adapt or cope with any stressful condition. Okay? When an individual is mentally ill, it causes that disruption. So somebody who is able to adapt to stress initially, but as a result of mental illness is unable to adapt to that stress. Okay? Then all the coping mechanism the individual has is broken down. Then please begin to suspect a mental illness. Okay? It also affects the productivity. There's someone who is mentally ill that will be optimally productive. Okay, because there's a way it affects the way you approach or address certain conditions, and your output definitely is going to reduce. So mental illness causes disruption in all these areas of the person's life and causes a nuisance to the society. And the most common one we know is those who we call the mad people. When we see them wandering around the street, they are a nuisance to the society. And at that point, this person has what? A mental illness. So a disruption in the coping mechanism, the person can no longer cope. Is depressed. Somebody who is able to do some things in the face of challenges and difficulty, but suddenly gives up. Okay, gives up hope and believes that no, there's nothing that I can actually do. Probably the next option would be to probably commit suicide or any form of deliberate self-harm. Then we should know that there's a mental illness coming up. So mental illness causes disruption in all of these capabilities for that individual. Okay, so next slide has to do with the prevalence. How common is mental illness in our society? Mental illness is very, very common. And we found out that at least every family member has somebody with mental illness. Every family, every family has someone with a mental illness. So which is very, very common amongst us. Just that the severity may differ. It may come in a mild form, in a moderate or severe form. Oftentimes, it's the severe forms that we tend to see. Those are the ones you may now probably take to the hospital or take to the spiritual home or take to therapists. Those are the severe forms of mental illness. But apparently, each member of the family has one form of mental illness or the other. Okay, and the more common mental illnesses that we have in our community is depression, which is what we know. Everybody, any small thing, I am depressed, I'm traumatized, it's affecting my mental and emotional health. That is a diagnosis, and depression is common. Also, we have anxiety. When people are anxious, they are fearful, you are not sure of what will be the next thing that can happen to you. You are afraid of this is common in children, afraid of going to a dark room or a secluded environment. That's anxiety. Or you have a recurrence of something that's happened to you in the past, what people call PTSD, that's post-traumatic stress disorder. Something harmful, an horrific event that's happened in the past, and you have this flashback of that event. Okay? that may actually cause anxiety, and it's actually a mental illness. Harmful alcohol use and dependence. Somebody who resorts to taking alcohol, he doesn't take alcohol initially, but find out that the individual now goes on to resorts to taking alcohol, drug abuse, smoking, and involves in use of hard substance, cocaine, and all those things. Okay, that's also a manifestation of mental illness. Then somatization disorders. What do we mean by somatization disorders? These are, at times you have these symptoms. It's common among women. You have this symptom that you feel there's something going on within you, but you've gone to the hospital, you've done a lot of tests. They can't really identify what is really going on. At times, you see people come to you and say, doctor, something is walking around my body. Okay? Something is just crawling around my body from my head to my toe. And apparently, you've done tests. Doctor has examined you. You've gone to so many places, they can't actually identify what is the cause of this problem. That is a somatization disorder. Okay? When you have this symptom in the absence of concrete evidence of that symptom. Okay? So, it's also a sign of mental illness, and it's common with people who have depression and some mental issues. Okay, so they come to you and say they have this symptom. Okay, women and also in elderly people, they can actually present this way. So those are the various forms of mental illness. There are a lot of them, but the ones that are common in our environment are the ones I just listed briefly. So what are the predisposing factors to mental illness? What are the things that expose us, that makes us liable to develop mental illness? There are a lot of them, but I just briefly summarize some of these things to this slide, and we'll discuss them one after the other. They are all things we are all familiar with, and by the time we explain, we're able to understand briefly, fully, how these things affect our mental health. One is socio-economic factors. This is no news. You understand the economic challenge of the country. Prices of food skyrocketing, rents, bills, a lot of so many issues regarding our economy. Okay, it's really affecting our pocket. And in a situation where you are not able to meet up with the financial obligations or financial challenges, it actually predisposes one to emotional health. If you had people where in the news where they actually want to jump from the bridge, want to commit suicide, deep interrogation, after interviewing them, they will tell you, fine, economic hardship. We recently had somebody in Abuja who climbed a mast, who wanted to end his life. Why? Because of economic or financial challenge. So it's a major factor, and this really affecting families and individuals, and it's predisposing people to mental health. When probably the father of the house is not able to meet the financial obligations in the family, definitely it's going to affect a lot of things. Okay, it becomes irritable, and a lot of things may actually settle. So socio-economic factor is a major predisposing factor that exposes people to mental health issue. The other point here is workplace stress. Stress at work. Especially certain job where you need to meet targets. Okay, so actually this come among those who are marketers, where you need to meet targets. Your boss gives you, you need to make a target of 500 million naira in the month for you to be able to, for promotion and other add-ons. And you are there, you are still struggling to meet up 50 million. You understand? It's a major stress. How will you make up with your targets? Okay, at times we tend to, after our work hours, we tend to move some of our activities home when you're supposed to rest and chill with the family members. That's when you now start working on your system again in order to be able to meet up with your work objectives or targets. So workplace stress, I've been found out that it is a major predisposing factor to mental health. Okay, then dysfunctional family life. What do you mean by dysfunctional family life? Now, a family is the smallest unit in the society. We all know that. It's the smallest unit in the family. And the family serves several functions. One is for nurturing. The family is to nurture, to take care of the kids from right from newborn to when they eventually leave the house. Even after they might have left the house, the family still serves a form of nurture. It's to give support. Okay? Family is to give support. Okay? For protection, the family serves as a means of reproduction. But the most important thing is a family should serve as a nurturing ground, a place where children and individual get nurture and before it's moved or pushed into the world. But in a family setting where this does not hold, you find out that children, adults who tend to go from a dysfunctional family, usually this is common also in a polygamous setting when there is rivalry between wives within the family, okay, it's a risk factor for mental illness. Or a family where they are separated, a dissolved family, or a family where the husband and wife are no longer staying together, then the children are left alone, okay? They're exposed to a lot of things that ordinarily they shouldn't have been exposed to. The nurturing they need to get from the father is no longer there, or the upbringing from the mother is no longer there. So these children are exposed to stressful life events, even at a young age. And by the time they grow, is a major factor for mental illness among them. Then faulty parenting styles. What are the parenting styles that we use? For example, you'll find out that there are certain parenting styles that tends to affect children and in long run affects their mental health. For example, this is common among our mothers. If a visitor should come to the house and by the time they are leaving, they want to give a child some money. Ordinarily, you don't want the child to accept that money, but in a way, you may say, "Ba." You understand? Literally, you don't want that child to collect that money, but you wouldn't know how to put it. So, in order to, or after the child, if in eventuality the child actually collected the money, by the time he leaves, the visitor leaves, definitely he may actually go back to spam the child who has to take that money. So when you are passing a message contrary to what you actually meant, it's actually a major cause of mental illness among children. You understand? Or you said, "Mommy, where should I put this?" And put it on my head. Put it on my head. The child is confused. Should I actually do this and put it on my mommy's head? You understand? So those things actually affect the way they relate. And you may be shocked. Some children may actually put such thing on your head. And you understand? So it's a major cause of health challenge in children. So children are left confused. Children are confused. They wouldn't know what to do. So it's very important for us to understand this parenting side. By the time you want to correct a child, please use the appropriate words because it actually affects their mental health. Then crime and violence. This is common, usually for those who are from the north. Exposure to crime and violence. By the time you grow up, it goes a long way to affect the child's mental health. Or children who are also exposed in community where we have people who call area boys, where they perpetrate all form of evil, where they smoke, where they take alcohol. It's likely to also influence the character of that child by the time he grows up, if the child is not well nurtured, because by what they see is actually what they actually practice. So crime and violence is a major cause of mental illness. Then availability of psychoactive substance. When an individual has free access to drugs, to alcohol, in the street, is everywhere. They sell this dry gin. This gin in sachets. Actually send children. Some parents send their children to go and get some of these things. And they see their parents take them. These things are readily available. A child can easily go and buy these materials over the counter without any form of restriction and can actually predispose them to mental health. Unstable marriages, just as I've mentioned, divorce, separation, okay, is a major factor that predisposes people to mental health. Then strong peer group influences. If you have your friend in school who smokes, who takes alcohol, who takes hard substance, there's tendency for the individual to also what get engaged in that in that form of practice, and this can also influence um, their mental health. Then globalization of values. What we mean by globalization of values? It's all over the world now that gay rights, okay, there are people who are legitimizing marriages, and it's also coming down to our own setting. Churches also legitimizing things like this. Okay, we also need to look at this. These are values that are not in our context, which were not what we were exposed to. But now, because of globalization, internet, access to information, these practices are becoming part of us, and you see people coming out openly to legitimize some of these things. So it's very important. It's very important for us to know that values that are being brought up from the Western countries actually exposes us to mental health. Okay, traumatic social experiences. What are some of these things? Just have mentioned somebody who has experienced, probably a young girl who has been raped in the past, or somebody who has experienced armed robbery, a fatal accident. There's tendency for the individual to suffer flashbacks from these experiences, and they may affect the individual's mental health. We've had cases where we have just few months ago, we have a couple they had to see the gynecologist. Why? Because at the point the wife had issue with had a forceful sexual experience while she was still young. So after she got married, the challenge of consummation of her wedding was a major problem. That the husband was actually really, really distressed. They had to come and see the doctor that what can they do to solve some of this problem. And it was actually due to the previous experience that she had. We also had a woman who had a delivery sometime. During the period of the delivery, she had severe tear in her vagina, okay, after she delivered. And since then, anytime the husband wants to meet with her, she actually rejects outrightly, and that has been a major problem because of that experience during the childbirth. So traumatic experiences, social experiences, is a major predisposing factor for mental health. Then background medical condition. There are some health conditions that exposes us to mental illness. For example, diabetes, hypertension. If you have to visit the hospital almost all the time, every month you have to go to the hospital for one health condition or the other. Or you have to be on so many drugs in order to be able to be fit. It's actually distressing when you see someone who doesn't have to take even a single pill to stay healthy, and you are there, you have to take 4 or 5 drugs in order to be able to live a normal life. Okay? There's tendency for the individual to develop mental illness. We have people who suffer recurrent pain, especially sickle cell disease patients who are in and out of the hospital virtually all the time because of pain. That is a major stressor. Actually, we've had people where they are, and if you are who even prefers to die because of the pain she was experiencing, and she can't continue like this, in and out of the hospital because of pain, okay, from sickle cell. Then doctrinal philosophy and religiosity is also a major factor, okay, especially when we visit spiritual homes and they tell you your grandmother, your great-great-grandfather is the one responsible for your illness or for your poverty. That's why you can't excel in life. There's somebody in your family who is actually behind all this atrocity, okay, that is befalling you. It's because of doctrinal philosophy and religiosity, okay. So this actually affects people. You see people moving from one spiritual home to another because of false doctrines, because of religiosity, Okay, you must pray 100 times before you get deliverance. If you want to be promoted at work, you must make sacrifices. Okay, these are false doctrines that actually affect our mental health. Then genetic and biological factors. What do I mean by genetic and biological factors? It means that there is a tendency for an individual to develop mental health if a family member has a mental health issue. There's also there's also a tendency that, for example, if your brother or your sister or a family member is sick, there is also tendency for that individual to also play that sick role. Okay, it's also a major factor. So if you have somebody in the family who has mental illness, there's tendency for any other member of the family to also develop the same mental illness. So very important for us to know this. Just like other diseases, if you have somebody who has hypertension, there's probably father or mother has high blood pressure. There's tendency for other members of the family to also develop high blood pressure. So those are factors that actually exposes us to mental illness. So in what ways do mental illness manifest? In what ways? There are different diagnoses for mental illness, from the ones that are subtle, that are mild, to the very severe ones. The severe ones are the ones that are apparent, we see on the road, and we take to the hospital. Okay? But it can manifest as unhealthy lifestyle behaviors, just as I've said. If you see someone who is apparently healthy, individual who does not smoke, does not take alcohol, but suddenly begins to practice such activities, then is a manifestation of mental health. That person needs help. He needs to smoke before he can calm his or her nerves. He needs to take alcohol before he can carry out their normal activity that they do even before the event happened or occurred. Then is a mental health. So that person is already abusing, we call that drug abuse or substance abuse. Then is a manifestation that, yes, this is a mental health, this person needs to be helped. Then depression, that's a major manifestation of mental health. Mental health issue or mental illness can manifest as depression, which is what we all know. How does depression come up? So depression comes up when an individual is withdrawn to him or herself. Somebody who likes talking, who likes carrying, who is very active, jovial person, who plays a lot. Suddenly the person withdraws to him or herself. There's lots of pleasure in the activities he loves doing. Okay? Then you need to suspect depression. Okay? Poor sleep, doesn't sleep well. Find out that always complain of body weakness. His activities are reduced. Okay? His energy is now low. Okay? His mood is low. He has low mood. He feels always unhappy. Okay? When others are smiling, his face is flat. Okay? Then you need to suspect depression. And the hallmark of depression is suicide. That's the peak of depression. Somebody who is severely depressed are the ones that eventually go on to commit suicide. So depression is a major manifestation of mental health. Then we have anxiety. Anxiety has to do with fearfulness. Fearfulness, when the individual is always fearful, okay, cannot confront life, various things that the individual is exposed to. Okay, for example, I know some people, if they're in a closed environment, they feel choked. Okay, in a closed environment, they feel choked, or they can't even climb a height. You need to go 2 or 3 steps or 2 or 3 floors. They feel agitated, they feel fearful. Okay, they are worried about what life is all about. That is anxiety. Some people suddenly, while they are sleeping, they suddenly wake up and they are panicking. Okay, that is anxiety. Or they have flashbacks of events that have happened in the past. Probably they've escaped accidents, and they have this recurrence of that event. How God actually help them. They feel fearful and agitated. I'm aware of, there's also a family member who lost two of their children in the hospital at the point. Anytime they move close to the hospital, you see the wife agitated. She tries to avoid that hospital. Actually, if they even have to visit probably somebody in the there's a particular ward in that hospital they have aversion for because of they lost two of their children on that ward, and since then their life has never remained the same. So anytime they move close, at times they even try to navigate through another route. They don't want to pass through the premise of that hospital because of the events they've had in the past, and that is anxiety. Okay, similar to extreme anxiety disorder I've explained. Aversion for things that make them to remember or to have flashback of that experience. Then we have schizophrenia. Schizophrenia is also a manifestation of mental health, and that is what we are conversant with. People we call mad people. These are the people we see walking on the road. Okay, that is schizophrenia. These are the frank mad people. And what happens is they feel they hear voices. You see them talking to unseen people. Okay, because of that's how their mental faculty has been built at that point in time. So they talk to people, they hear voices of people that people cannot, listen to, that people cannot hear. So they are the ones that begins to communicate with unseen people. They believe their thoughts are being imposed on them. So they believe in a weird way, such that it affects their relationship with people. They have loss of insight. They are not aware of what is really going on. That is schizophrenia. They are the ones that you see them hoarding rubbish. Okay, they wear tattered clothes on the road. They are always unkept. That is schizophrenia. That's a major manifestation of mental illness. Then cognitive disorder. This has to do with memory loss. Memory loss, when people begin to lose their memory. They forget things easily. And it's also common in our environment where you probably keep your money somewhere, and after 5-10 minutes you are looking for the whereabouts of where you actually dropped that money. It's a mental illness because you are losing concentration. By the time an individual begins to lose concentration, the mental health is already affected. It may be subtle, may be mild, okay, but it's a form of mental illness when there's loss of concentration. You can't really identify where you actually keep some of your things, okay. Then in the extreme form is the one we call dementia. That is common in the elderly people, when you actually forget everything. You can't recognize faces, you forget your age, you forget events that have happened in the past. People that are actually living close to you can't really identify them, okay. It's a mental illness, and this is actually common in the elderly people when they suffer dementia. But the subtle ones that we see in our environment is memory. When we lose concentration and we can't identify where you put some of those things, and we begin to accuse somebody else of stealing your property, not knowing that you're actually the one who has lost concentration. Okay, then eating disorder. So when we come back, eating disorder, this is also common in young females, in adolescents. Okay, and it's due to a condition where they want to maintain their body shape. So they tend to starve. They want to be model. They want to be like letter L. You understand? They don't want to grow big and stuff like that. So they tend to starve themselves. They starve themselves a lot to the extent that they lose weight so that they can maintain that stature. Okay, that is a mental disorder. We have some people, we call it anorexia nervosa, where people actually tend to starve themselves in order to maintain their weight. The other one is bulimia. What happens is they eat heavily, binge eating. After that, they induce vomiting. Okay, it's also a way to maintain their shape, maintain their status, because of what the society is talking about. But it's actually a mental illness. Okay, eating disorder. Then the other one is drug abuse, which I've discussed about, when people tend to abuse medication. If it's somebody who is abusing drugs is actually a mental health. He's trying to cope with certain challenges in his or her life, and he has to resort to taking substance in order to be able to cope with that challenge. Okay, so general principles of management. How do we manage mental health issues? Okay, broadly it can be divided into three. Okay, spiritual dimension to mental and emotional health, and that is where the church comes to play, and that's where we have the pastor, the deacons, the church, our spiritual leaders, where they help us to navigate through this process of mental health. Okay, we seek hope in God through our spiritual communication with God. Okay, so that's where the spiritual aspect comes in, and that I'll leave to the church, because day in day out when we come to the church, we listen to the word of God. We are we are we are we are we are being exposed to the scripture. Okay, that is actually a spiritual aspect, because there's spirituality in medicine. There's spiritual aspect of medicine. When we need to pray, at times we need to pray, open God, read our scriptures to get word of inspiration that actually helps us to cope with the challenge. So there's a place for spiritual dimension in managing our mental health. Then also is the professional aspect, where we see therapists. At times, it's necessary for us to see the therapist, the clinical psychologist, who helps us through certain sessions. At times when people are depressed, they say, okay, go and see a therapist. That is licensed professionals that can actually help us to navigate the health challenge we are going through. Then the medical consultation, that is a place of the hospital in managing mental health. I would draw a bit on this. Yeah, so just I mentioned earlier, because of the way mental illness presents, most people don't actually go to the hospital. Okay? First point of call oftentimes is spiritual home or the church. And we found out that let's talk about spiritual homes, not the church. The spiritual homes, that's where we have these spiritual homes now, where they take mad people, or those, quote and unquote, those who believe have mental illness. That's where they take them to the spiritual homes. They tie them, they flog them, they do all sorts of atrocities in order to be able to what? To eliminate the mental illness the individual is suffering from. That is a major point of call, because we found out that most people who actually are taken to mental homes actually need medical attention. Okay? And they tend to cause more harm for them than good, because the exposure to the torture, at times they may be starved, they use herbal concussion, that may actually cause more harm than good. So it's just a way to let us know that though we may need to seek spiritual attention, most of these spiritual homes are not the best place for people to go to. So as a way of communicating to us, please, when we have people with mental health, seek spiritual help. That is there's no aversion to that. We need to seek spiritual help, so that we can we can have access to God, which is our almost source of hope. But the medical aspect is very, very critical, because some of these, there are drugs that, apart from the professional counseling that we talked about, that is actually with psychotherapy, help people to navigate through this stressful event they are going through. Medications actually help as well. People who suffer from depression are placed on antidepressants. These are drugs that help to prevent depression. And they actually work. Okay, they actually work. It helps them it improves their mood and helps them to become socially, competent, and help them to be able to navigate themselves and return back to the society. For those who have mental illness, some of these people we see on the road that are left behind, that are left on the road, they actually do well if they are placed on medications. We call those medications antipsychotics. And the study was carried out and found out that most of these spiritual homes where they take them to, the drugs, some of the things they use for them are actually medical drugs. There are drugs that they use in the hospital that they make as concussion and give to them. If they are aware that these drugs can actually be, these people can actually be taken care of in the hospital, they would actually take them there. So let's create this awareness that there are drugs that can be used for various mental illnesses. Not all mental illness requires drugs. Some may just need advice, counseling, but majority of the mental illnesses that we see, okay, actually needs drugs. For example, for people who are anxious, anxiety, apart from psychotherapy, apart from spiritual counseling, there are drugs, we call them anxiolytics, that make people to relax, make them feel relaxed and comfortable. And by the time you use some of these drugs, you find out that you are doing well, okay? Then for those drug abuse, it's difficult at times for you to suddenly tell an individual to stop taking medications. To stop taking alcohol, to stop smoking, and some, because by the time they withdraw completely for some of these things, it may actually cause more physical symptoms. But there are medications that can be used that help them to completely, if they decide to stop taking some of those medications, there are drugs that can actually help them to completely discontinue taking those substances. And by the time you see, they would actually return back to their normal state of health. So just a recap of what we've discussed, that mental health is something that is common in our environment. It is actually with us. Every family member has an individual with a mental health condition, because mental health is not apparent, is not something that is physical or tangible that we can hold, okay? People are not aware, and usually they sought for alternative methods of treatment, which oftentimes is more harmful. And by the time we are aware of this, and by the time we begin to understand that this is actually a mental health, a lot of damage might have been done. General principle involves both spiritual counseling, that is where the church comes into play. Our spiritual father, pastor, the deacons can actually help us through the word of God to navigate some of these stressful conditions. The therapists, which are clinical psychologists, can also help us to navigate some of these challenges. Then there's a role of the hospital that helps us to manage some of these challenges when they come, and helps us to rehabilitate and return such an individual back to the society and live a relatively normal life. Thank you.
Praise the Lord. We are so blessed today with this topic, and I believe we have learned one or two things. Some people came, they said we should try and speak Yoruba. I think some of us that have elderly ones at home that doesn't really understand this topic in English, probably when we get to home, let's discuss together some of the things that we have learned and